Hey, 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 Fit Mama. Jen Oliver here, your host of the Fit Mama podcast. This is the work in to your workout. Hey, Fit Mama, and welcome to today's episode. I am so excited to introduce you to one of my favorites, a naturopathic doctor and integrative fertility expert, Dr. Janice Davie. Dr. Davie helps couples to optimize their health in order to optimize their fertility, reduce their stress, and to feel empowered along their fertility journey. Her mission is to improve the health of our next generation through preconception and perinatal care. Dr. Janice Davie maintains a local practice in Amherstburg and Tecumseh, Ontario, and she supports couples locally and also globally who are trying to conceive. She can be found at all the links in the show notes. This episode, we dive into how she helps women. We give you some really great information on the perfect period, PMS symptoms, toxins, and so much more. Tune in, enjoy. I can't wait to hear your feedback. Here is Janice. And here we are live in the Fit Mama Global headquarters with none other than Dr. Janice Davie. Thank you for being here.
Thank you, Jen, for having me. Truly, I'm so honored that you asked me to come on the show.
This is a real treat. I have known Janice. How long have we known each other now? Probably almost 4 or 5 years.
Or at least 4 years, yeah.
You know what? It is such a blessing to know you. And now knowing your daughter as well as I do, and she pops by for her visits. She is my favorite. We love her. My girls love her. She's an absolute delight, and it's no surprise coming from you. You are amazing. So I know many Fit Mamas already know you, love you, because I always link to your stuff online. And today I want to dive deep in with you. I know you have quite the journey of your own. You have such a wealth of expertise in the areas of hormones, in the areas of helping women optimize their hormone journey and fertility and just feeling good overall. I love that you are such a wealth of knowledge in terms of actually hands-on stuff, right? You're not just talking about stuff, you're giving people actionable items, which is one of the things I love about you and why you help so many people. So we will dive right in today with you, beginning with how you got into being such a leading expert on hormones, women, fertility, all the things. Take us back, Janice.
Oh gosh, I mean, I think as women, we're all sort of naturally interested in our hormones and what our body is doing, and
without our knowing or consent.
Yes, absolutely. So I mean, I've always been interested in health and health promotion and disease prevention, which led me into naturopathic medicine, basically, and throughout my education there, that's when I started to get really passionate and excited about women's health and hormones and fertility. You know, it was just, there's so much that can be done naturally to balance these things out and to optimize hormones and to optimize mood and fertility.
Now, did you have PMS yourself? Did you have issues around period stuff that you were looking to optimize, or people in your life that did?
You know what? Gosh, I don't think so. I can't even remember because, you know, I've been working with this for so long. But no, I don't think specifically. I think it was
you just knew it was an area where you could help people.
Yeah, and you hear it all the time from our friends, from our family members, like, ugh, my period, it's painful. I have to stay home from work, you know, on the first day, or it's so heavy, or this is awful. And you're thinking, it doesn't have to be like this, you know? It really doesn't. You can fix this. You can change this.
No, it doesn't have to be like this, though.
No, people just accept that it's their normal because it's always happened, right? It's been like that since their period started, or their sister has had that, their friend talks about it, their mother had the same kind of thing, you know? And it's just like, oh, well, you know, that's the way things are for me. But it doesn't have to be like that. And so many patients that I see, you know, we do a little bit of work, and I mean, it takes a little bit of time. Like hormones are something that takes, you know, a month or two to kind of come around, right?
Yeah.
And depending on where you're at, it might be a little bit less, might be a little bit longer. But women will end up saying, I never knew that my period could be like this. You know, I didn't even know it was coming. I didn't have any PMS. I didn't have any cramping. You know, I didn't have a warning, you know, and I'm so used to these things.
Yeah.
And then it just becomes easy breezy. So,
So what kind of things are we talking about? I know you're a real expert in what the perfect period really is like. So what can people sort of expect their period like, or if that's their ideal and goal, how can they know if they're off that?
Yeah, this is something we never talk about, right? You hear all of the horror
parts of
stories,
it.
just kind of like you know, birth stories. We hear all the terrible stuff, but never the good
we
stuff.
don't hear the joy,
right?
the opportunity.
So what the possibilities are, you know, what your period could look like and should look like. I talk a lot about this with my patients every day. And, you know, nothing fits into a box, right?
No.
Everybody has their own little differences, but really your period should be regular to start with, right? It should be between about 26 and 35 days. You know, so anything,
whatever the day is, it's usually on day 28 or usually day 32.
Exactly. And consistently, plus or minus a couple of days. You know, you don't want to have 1 month where it's 26 days and then 1 month it's 35 days. You know, if 1 month it's 32, the next month it's 30, that's okay.
Right.
You know, there's a little bit of variance and things play into that, right? Diet, stress, you know, travel, all those kinds of things, lack of sleep. Right. Yeah. So sometimes there's a little bit of change.
Okay.
So first of all, it should be somewhat regular.
Okay.
And you really shouldn't have a lot of PMS leading up to it. You know,
I have what kind of things like that? Cramps?
Cramping, pain, headaches, skin changes, mood for sure. That's probably the biggest one that I hear from women, right? It's the like, I don't know who I am this week before my period. I have so many moms that come in that say, I'm screaming at my kids, you know, and they're just looking up at me with these blank, innocent faces going like, what is happening right now? And you know in your head that, you know, I'm a crazy person right now. I am not acting
I'm crying,
like my normal self.
Everything makes me cry.
Everything makes me cry. You know, okay, it's fine. You get a little bit tearful at a commercial or something like that. But, you know, that's what's sort of like the normal and that's okay and acceptable versus the like, what is going on right now?
Especially if it's consistent. Right? Speaking of consistency, if every month on that day or around that time you're freaking out.
Exactly. If it becomes a pattern, then it's something to work on. If it's just a one-off, okay, well, you know what? Let's just kind of let that go and chalk it up to some other, you know, stress that's going on or something. So you shouldn't really see any of that. You know, some women have sleep issues right before their period, their sleep changes, their digestive system changes, and we shouldn't see a lot of that happening. Minor little fluctuations is okay, but if it's enough that it's, you know, got you kind of down about it or it's really bothersome, then that's something to look into fixing, right? So then your period should start, and the day that your period starts is considered day 1. Right? So that is day 1 of your cycle. And your period should start with a good start. You know, it shouldn't be, you know, spotting 4 or 5 days before and kind of this like hesitant start to your period. It should, you know, it should come on maybe a little bit lightly and then get a bit heavier through that day.
And what does that mean if it does come on gradually, if you do have spotting for a few days?
So you're just not having, sometimes it can mean a progesterone deficiency, but I do a lot of acupuncture and Chinese medicine in my practice. And so Chinese medicine really looks at the periods like this. And Chinese medicine is really asking for a very efficient period, right? And we all want that too. I mean, who wants to be wearing a panty liner for, you know, 2 weeks on either end of your period, right? It's just, right? No. So you want a period that kind of starts and stops concisely, you know, or succinctly, right? Nothing that's dragging on or starting from either end.
So there could be a hormone issue if you do have the dragging on.
Could be a hormone issue that's going on, right? So your period should start out, and periods usually do one of two things. They either start out a little bit more slowly where things are a little bit lighter, and then they get heavier into maybe the second or third day, or they start out fairly heavy that first, second day and then kind of taper off from there. And the period should be not painful, you know, so it should be not painful. There shouldn't be clots. I mean, some tiny little, you know, kind of things are okay, but there shouldn't be a lot of clotting. There shouldn't be a lot of cramping.
If there is clotting, cramping, what is it? Again, hormones are off.
Also, hormones are off, right? We could see some estrogen progesterone imbalances. We could be seeing things like endometriosis, fibroids, especially if we're seeing a lot of cramping and a lot of clotting, right? And a lot of pain. So we shouldn't be seeing any of that. the period, the blood should actually be a nice bright red. We shouldn't see anything that's very pale or watery looking, and we shouldn't see anything that's like really deep, dark, and purple. And it should be a good consistency. You know, I know this is getting really detailed with periods, but this is what I talk about day in and day out. So,
for you, not
for me,
TMI.
nothing. We can talk about this over dinner. And the period should have a good consistency to it. So it shouldn't be really thick and goopy or mucusy, but it also shouldn't be really runny and watery. You know, so we're looking for like that nice bright red flow.
Right.
And then, you know, things should finish up pretty nicely too around day 4. You know, so if your period is dragging into like day 6, day 7, day 8, day 10, that's
Still having bleeding.
Or spotting afterwards.
And how do we know how much is a good amount? Like if in a Diva cup, we would change it how many times, or how many tampons you would go through?
A good question. There is variance of what would be normal here. And what I would say is if you were going through a pad or a tampon or the Diva cup, if you're bleeding through that in less than 2 hours, that's probably too heavy,
much.
right? And then we're starting to be concerned, well, where are your energy levels? Where's your iron going, right? And there's this tricky thing that happens with iron is that the more iron deficient you are, the heavier you bleed. So then the more iron you lose. So then the more you know, and it's just a vicious cycle that you can sort of get into. So something you really kind of want to tidy up. There too.
Bleeding for 10 days every month sounds like way too much loss of blood.
Way too much, especially if it's heavy bleeding, right? But even if it, like I said, if it's that trickling off and the spotting that's trailing off, that's just annoying, right? So we want something that's a little tidier, something that finishes up day 4, day 5, and a period that just sort of trails off nicely, but does not linger on, you know? And then there also shouldn't be any mid-cycle spotting, you know? I mean, maybe a tiny little bit here or there can be normal around ovulation time, but there shouldn't be bleeding on and off throughout the period, right?
And if people are finding that, I talk to a lot of women who are sort of figuring out birth control after they have kids, for lack of a better, term. It's kind of like, what do we do? Do I get an IUD? Do we get my tubes tied? Does he get a vasectomy? Do we use condoms? Do we go on the pill? Do we get, there's so many options. And I know each of those kind of throws people off. Where's the first place to go to, or who do we talk to? How do we sort this all out?
Yeah, so for sure, it becomes a really tricky one. How do you, most of the time I'm working sort of the opposite of how do we find our fertility window, right? But you also want to know where your fertile window is if you're trying to prevent, more children, right? And this is a trap that a lot of my fertility patients fall into as well, is relying on their app. Right. So it's one of those mistakes that women make is they put their period in their period tracker or their period app or whatever it is, and the app will come up with, here's the day that you ovulate. Right. So if you're trying to have kids, then that's your window of opportunity. If you're not trying to have kids, that is where you should, maybe stay in another bedroom or something like that. Right. And avoid those times. But you really want to see what your cycle is doing, because the app is never perfect. Right. So the app is just going to basically take your cycle and minus 14 days from it and put that you ovulated right then and there. But your signs and symptoms that your body tells you is going to be much more accurate at that, right? So some women track temperature, but I really like to encourage just looking for cervical fluid, actually. And you can start to be the easiest. You can start to see that happening mid-cycle, so in a perfect period, that period would end off around day 4, day 5 maybe, and everything should be pretty normal, no other real discharge for a few more days, but then maybe starting around day 10 you start to notice a little bit more cervical fluid, right? And it'll start out maybe a little bit watery, but then ideally, if you're trying to conceive, that cervical fluid becomes a little more slippery. And in the days where you're seeing that slippery kind of cervical discharge or cervical mucus, that is your window. That is your fertile window, right? So that is either your opportunity to conceive or the time that you really want to kind of stay away from things, right? However, cycle tracking is certainly not a foolproof method to preventing additional children, because we all hear those stories of, too often, right? If a baby is coming out, like sometimes they say if a baby is meant to be, a baby is meant to be, right? Because you hear women, there's like, this doesn't make any sense. I know my husband came nowhere near me for these 2 weeks, and then, it shouldn't have matched up to my cycle. So sometimes some strange things happen. But yeah, that's kind of what you want to look at. As far as other, prevention techniques, I mean, tying tubes is kind of a big ordeal. A
Surgery,
vasectomy, less so.
Yeah.
Birth control pills can work really nicely for some women. For other women, it makes a mess of things. I see a lot of women who are on birth control and it's not working for them. They're finding their periods are heavier, or they're spotting throughout, or their PMS symptoms are worse, and so a lot of that can really, play into.
Now, how come there is such variation?
All depending on where you're starting, and what your hormones, what your natural hormones look like, right? Now you can do blood work and look at these things, but I find personally, and in my practice, that blood work doesn't give us a lot of great information. There's such a wide range of what's considered normal when it comes to things like estrogen and progesterone, and everyone's a little bit different, right? So you might fall
So everybody falls in the normal range.
Everyone falls into the normal range unless there's something very drastic going on, right? So your signs and symptoms usually tell us a little bit more, right? And so if your signs and symptoms before your period, might point to more progesterone deficiency, or might point more towards estrogen dominance, then we can maybe look at a birth control pill that might work nicely for you, that balances out that hormones. If you already are in an estrogen dominant state and we add an estrogen based birth control pill, we might just be making things worse, right? So sometimes we've got to kind of work with that a little bit, rather than just
there's a lot of
throwing.
details. Well, and it's not as easy as, hey, try this one out for size, do it. Because I've seen women suffer or struggle for a better part of a year or more with just trying this, then okay, that didn't work, and every cycle you have to kind of reset, and it's intense.
It is, and I find it's the thing. Naturopathic medicine does hormones really, really well, right? Conventional medicine doesn't have as much to offer.
Right.
I mean, I'm a big fan of conventional medicine, but really when it comes to periods, it's, let's try birth control. And if this one doesn't work, then we'll try this one. And if that one doesn't work, we'll try this one, and we'll play around with it, right? With naturopathic medicine, there's so many, lifestyle interventions that we can look at, but then there's also so many really great supplements out there that support our body to balance out hormones naturally. And it's one of the reasons I do a lot of acupuncture in my practice, because hormonal imbalances respond amazingly to acupuncture. So it's one of my go-tos for sure. Yeah.
Now you do work online and do consultations, and you do supplement recommendations, and you do blood test readings and all that stuff online, right?
Yeah, well, most of it here in Ontario, our guidelines are a little bit strict. So for patients who are needing more clinical work, then I like to see them in office, right? We can look at lab tests. I can make supplement recommendations and prescriptions. But if we're working online, I can certainly consult, but I can't make the same sort of, diagnostic and clinical
without
recommendations.
Actually seeing the person.
Yeah. So totally online, we tend to work a little bit more lifestyle kind of stuff. And in the office, we tend to work a little bit more clinically.
Right. Yeah. Awesome. And that's one of the things I do love about your work so much is the coaching aspects of what you do. Is that like I said, you make it really accessible to people to create new routines, new habits, and have lifestyle changes that become part of their life that actually positively influence them, sometimes more than any other interventions.
Yeah, absolutely. I'm a huge fan of baby stepping things too, right? One thing at a time. Let's just add a couple of good things, right? And I love the idea of adding rather than subtracting.
I know restriction feels sometimes so
tough. And the more you restrict, the more you want those things, or you don't want to do those things. If you have to, we resist it, right? But if we can add some good stuff in, a lot of times that starts to fill up, our plate, fill up our lives, and the other stuff kind of just gets pushed by the wayside, right? It takes time to make change, right? And there has to be a mindset that's incorporated into it too. So, we can't expect sort of an all or nothing, way
so
to go.
tempting to want that. And that sort of leads us down almost that superficial path again where, hey, what's going to help me right now? Let's try this out. Let's try this out. And it feels like you're not getting to the bottom of it, but here's a Band-Aid solution. And, the mindset you mentioned is so, so important. And I love that you really help people with the mindset aspect, because you know how it is. Like, okay, let's try out this new change of lifestyle. And if people aren't, wrapping their mindset around it, or they have a lot of other emotional things that stand in the way. I mean, you work with a lot of fertility patients, you work with a lot of couples who have been trying to conceive for a while, you know, and they run the gamut of frustrated and angry to, you know, every other emotion in the book. So maybe you can talk to that for a few minutes.
Totally, yeah. And I always try and, I really try and walk my talk, right? So I don't often make recommendations to patients that are things that I haven't done myself, right? And I would never make a recommendation to a patient that's something that I would never do.
Yeah.
You know, like I'm not going to suggest that you take 25 supplements because I know I wouldn't take 25 supplements in a day, right? There will be a couple of key things that are going to work for you, you know, to make up for physiological deficits that you have or things that you're not getting out of your diet and lifestyle. But honestly, who's going to put the time, money, and effort into taking all of that in a day, right?
So true.
And so yeah, I mean, I go through all of these things as well. And so I have a little bit of a taste of where people are at, you know, what they're kind of thinking, how difficult it can be to follow a restrictive diet, or, you know, the mindset it takes to shift these kinds of things, right? So I try and work with that a lot. When it comes to fertility, I mean, my own journey is I mean, I've been passionate about fertility for
decades.
Years, and like years, probably about 15 years ago was I was just like, wow, there is so much that can be done before we get pregnant, you know, to influence the health of our baby, right? I mean, as moms, you know, we all start to think that way, right? Sometimes it's, you know, months or years before you get pregnant. But it's at least usually as soon as you find out you're pregnant. It's like, okay, I'm going to take my prenatals. I'm going to be consistent with this. I'm going to eat really well. I'm going to exercise. I'm going to do all of these things because I want the best for my baby, right? We're already caring for this baby well before, you know, they're even born, or sometimes
amazing how
even
inspired we get
of.
to do things for other people rather than ourselves.
Absolutely. I will do this for the baby, but I wasn't doing it for myself before. So, you know, I became really excited about, okay, there's all of this that you can do, right? And that's always been my approach to fertility is if you optimize your health, your fertility will come along with that, right? Your fertility will just rise up to that level. So whatever whatever kind of gets there as far as, you know, what you need to do for you and get everything balanced out for you, you know, your fertility will just follow with that. So I was really passionate about that years and years before I even was thinking about having kids. And then I started to do a lot more studying in the area of environmental medicine. And there was a talk that I watched, and I suggest people watch this talk. I recommend it all the time to my patients, and it's called The 10 Americans. And it's a talk done by Ken Cook. He's the director of the Environmental Working Group.
We'll link it up in the show notes.
Yeah. It's it like floored me. Like it was a jaw-dropping kind of talk for me. And it's an old talk. So about 15 years ago, the Environmental Working Group, and they're a lobbyist group in the U.S., and basically they lobby the government for better bylaws when it comes to, you know, chemicals and that kind of thing. And they put out a lot of user-friendly information for the public and the
Environmental Working Group.
Environmental Working Group, yes. Yeah. So Ken Cook did a talk on an experiment that the Environmental Working Group ran. And so, spoiler alert, the 10 Americans was basically a study done on 10 Americans where they drew the blood of 10 Americans and they looked for chemicals in their blood, right?
Never bodes well.
And exactly. And Canada repeated this experiment a couple of years after they did. And what they found was hundreds of chemicals in the blood of these 10 Americans. And then he goes on to reveal who these 10 Americans are. And it turns out the blood that was sampled was actually cord blood. So these are chemicals that babies in utero are exposed to, right? So as they're developing, as their brains are developing, as their organs are developing, as, you know, for infant or baby girls in utero, as their eggs are developing, right? As their nervous system is developing, as their immune system is developing, they're exposed to all of these chemicals, which can have an impact on how they develop and what sort of health, you know, they end up with, right? Or what sort of health conditions they wind up with down the road. So that's where I became really passionate about fertility, because I thought if we can just clean up our environment, clean up our own exposures, and I'm not talking about like the world at large. I mean, obviously that's a grand idea, and that's the ultimate
and we can take our
goal.
Part,
but we can play our own role, right? We can clean up what's inside of our home, what we put in our body, what we put on our body, and just by making those little changes at home, we can have a significant impact on the DNA of our babies, right?
It's powerful.
Powerful, huge, huge, huge. So it's something that I'm always like wanting to scream from the rooftops, right? Like you can have such an influence, for better or for worse, on your unborn children just based on your daily routine, right?
Yeah.
So that's where I became really passionate about it. And I was doing a lot of fertility work in practice, and it was something that I really loved. And then
were you finding when you helped people clean up their environment that they were then getting pregnant faster or more often, or?
It's a hard thing to kind of
quantify,
measure.
Yeah,
because we're doing so many things, right? We're working with stress and we're working with diet and hormone balance. So we're doing all of these things at the same time. So I think it's all part of, the bigger picture,
Equation,
right? In my fertility practice, I have this checklist that we kind of go through because I'm just, I like lists. I like checklists. I like lists. I like being organized. I like just, plans, right? So we go through this checklist and we work on all of the things, right? So it's a product of all of that work and all of that balance, right? But I really truly think that the reason there are so many fertility issues. I mean, everyone knows someone that's had trouble getting pregnant or some fertility issues, right? The numbers are about 1 in 6 in Canada now, which has dramatically increased from, 10, 15 years ago, 30 years ago.
And it's described as you want to get pregnant but aren't having any success.
Exactly.
Would that be it?
Exactly. After 1 year of trying, you've not been successful.
Got it.
And so we're looking at, what possibly could be going wrong. And so many patients I see, it's an unknown infertility.
Wouldn't that be the most frustrating?
The most frustrating. I mean, it's a good and bad thing, right? It's great.
Because there's hope. There's still
there's nothing wrong. There's nothing that you have to fix. But it also leaves you sort of lost going, what do I do then, right? What's the problem,
And do you run into that, would you say, consistently?
I would say most of my patients are in the unknown category. Okay. We're not really sure why this isn't happening for you, right? And but I think, I think that those things can be known, right? I think a lot of the things
just aren't looking under the right
We're just not asking the right questions. We're not getting into the detail. And I think a lot of the things, that's where I kind of created the checklist, is these are all the things that we need to have in place. If one of those things is not in place, then potentially, that's where we need to do the work to optimize your fertility and get that unknown factor known, right?
Right. Which, I think is so valuable, having a checklist like that and being able to check those things as in, you know what, I'm working on these things towards these things, or they're at least on my radar, which is really valuable. Now let's go even a little bit further into sort of the emotional toll that this can take. I mean, not only in fertility, or fertility issues, let's say, or the journey around that, but even once, we do have a baby. And I think there's so many, wherever you are on the gamut of having a baby, wanting a baby, whatever the case is, there's a lot of emotional things that they're dealing with. And you as a naturopathic doctor, you see patients in their holistic sense. And so that mental and emotional piece really can't be taken out of it. So how do you go about approaching that with clients? How do you work with clients in that way? Yeah,
the stress is a huge one, and I think, as I was mentioning, that, infertility rates are increasing, and I think it's a product of 3 things. I think there's 3 things in our lives now. I think it's our North American lifestyle, poor diet, lack of exercise, that kind of stuff is playing a big role. I think that the environmental exposures are definitely playing a big role on our fertility, but also on our hormone health too, right? That's one of the main areas of disruption, right? Endocrine disruption. Yeah. But the biggest thing I often see is the stress factor, right? So with my fertility patients, sometimes there's those other stressors, but often it's the stress of getting pregnant. It's the stress of the fertility process that's hindering their fertility, right? Yeah. And for, a lot of your listeners who are outside of the, childbearing years, or, you've had your babies and you've had enough babies and you're done, stress is playing a huge role in so much of our lives, and definitely our hormonal health too, right? Totally. It's playing into our sleep, and everything kind of feeds into one another, right? If you are stressed and not sleeping, then your hormones are not going to be balanced out. Then your periods are maybe going to be worse. Then maybe you have more PMS sleep issues, and it all kind of piles on top of one another, right? I think I have yet to see any sort of condition that does not have a stress component to it, right? Yeah. Even as much as we, I was always a person that was like, no, I'm not stressed. Like, I deal with stress really well. Yeah. I don't feel stressed. until something really big happens. And it's like, oh, I think maybe stress is playing a role here, right? Maybe there's something going on. And stress doesn't necessarily have to be this like monumental, thing that's happening in your life, right? It can be the everyday things. It can be just the morning routine, getting the kids out of the house in the morning, the thinking,
can
the
make
mental
you feel like you need a
stress.
vacation by 9 a.m.
Totally,
for sure.
totally. The emotional load, the decision making, all of that kind of stuff is stress, So those are really things to kind of tackle. With my fertility patients, I kind of have I talk to them about how to not try when you're trying, right? And I think that this is something that applies to so many of us, right? Is there's something that we're reaching for, a goal, a dream, as something, and it's just maybe not quite happening, And so sometimes you have to almost sit back and let it happen to you, right? Just go with the flow and things will happen. And I mean,
it's so hard when you really want it so bad and you want to take action, right? You want to do something, you want to feel like you're doing stuff.
Yeah. What else can I do? And with fertility, I call it the fertility perfectionism trap, right? It's you're trying everything and you're doing everything so well and so perfectly, yet that baby is not happening, right? The baby is not there yet. Your period is coming, every month, and it's a huge disappointment, huge disappointment, right? But how do you not try when you're trying, right? How do you not do that? How do you not go after your goal or go after your dream, when you want it so badly?
Well, it makes me think of even trying to find a man or a woman in your life. It's like, how you go around, you're trying to date, do all this stuff, and then finally you're like, I'm writing it all off. No man or woman is good enough for me. And then that person shows up in your life.
Yeah, they walk into the gym or something like that, and there you are, right? Love at first sight. So I have a little 5 little tips that I give patients basically.
I love this.
The first one, I say, just go buy the white couch. Right? Especially when it comes to kids, there's so many of my patients that are putting off their lives for this hypothetical
like they won't
baby.
buy a white couch because I'm going to have kids and that's going to be a waste.
Exactly. Don't buy new furniture. Oh, I'm not going to, the kids are, this is going to be the baby's room. I'm not going to renovate that. Oh, we're not going to take this vacation. The vacation thing is a huge thing, right? Oh, no, I'll be pregnant then. Oh, we'll be getting pregnant. Oh, the baby will be here by then, so it's not going to work for me. So you put your life off for years and years. Or if it's not the baby, it's the, oh, you know what, when I start to make this amount of money, or when we live in this bigger house, then we can do these things. Or when we have this, then I can do this, right? When I have this, I will feel this way.
That's a vicious trap.
It's a vicious trap. It's a vicious trap. And so you have to really kind of stop yourself and get out of that, feel that way now. Do those things now, right? Your life is now. So live
you can't make it
right?
Yeah.
You can't let 3 years of your life go by. Because you're waiting for something.
Which sometimes might be a decade or more.
Right? Which might be a long time. So I say, live your life.
Yeah.
Do the things that you enjoy.
Buy the white couch. I like that.
Yeah, buy the white couch. Right.
I'm not brave enough with my own self to buy the white couch. I'm like, who are these amazing people?
I know. We have pets.
Actually, I do have a somewhat white couch. My kids jump on it and I'm like, we'll wash it.
It's fine. It is what it is, right? No, we have pets and now we have a baby. So I've just decided we can't have anything nice for quite some time. And I'm okay with that, right? It's worth it. It's worth it. They bring us so much joy, so it's fine.
Yes. So live life now.
Live life now. Live life now. And the other thing I say is to stop focusing so much on getting all of the little things in perfect shape.
Put the ducks in the row.
Yes. What I say with my patients, my fertility patients for sure, is stop tracking. If you've been tracking your cycle for a while, you know what's going on with it, right? And it gets to be really tedious and we get hyper focused on it, right?
And I talk about this with women, who track their food intake or track macros and stuff. Sometimes it can start them off on a great thing, like because they're aware, they're focused, they're noticing, okay, great, I didn't overeat this because I was focused on it and I was aware. Until it's so tedious you don't want to do it, or you want to eat packaged foods so you don't have to go look it up or something, and then all of a sudden it backfires, right?
Totally. That is an excellent example, because I always say that. It's really, tracking is really great, whether it's your cycle, whether it's food, whether it's your symptoms, whatever it is. It's fantastic to see where you're at, right? And sometimes you gather some insight from that. But when you just are tracking and tracking and tracking and tracking, it's too much.
Arduous,
It's too much, and you got to just let go and let some
Well,
balance
and you're
in.
right. The hyper-focus piece, it almost like gets you to the obsessive spot where you're like, I have to track everything, control everything. And then it gets to the control bit, right?
Exactly, right? Or how many calories is that? Oh, no, right? Yeah, it's too
And
much.
I've actually heard, it's not unheard of to have people choosing something that they don't want at all on the menu because it's this many calories versus that many calories. And here you are eating something you don't like.
Yes.
It isn't going to satisfy you because
Right.
it's not even something you're desiring.
Right.
That's a tough place.
Yes, it is. And it comes back to our first point of live your life, right? Enjoy. We're here to enjoy things.
Yeah, don't put it off
know?
until you lose weight. And I always, it's actually not uncommon too for people to say, once I lose weight, I'll join the gym.
Yes.
This one kills me, right?
Yes.
It's like, no, what are you talking about? I don't understand.
Yeah, once I lose weight, then I'll be able to do these things. Once I lose weight, then I'll feel this way.
Yeah. Which I
right?
totally get. And I'm joking when I say I don't understand because that's the human psyche,
Yes,
right? Like I
yes.
get that, but oh man, you're right. It's time to live and feel good now.
Yeah.
Eat the things or do the things and not get to the point of obsession. That's a
Exactly.
tough place to be.
Yeah,
You're
and I mean,
right.
it doesn't mean eat chocolate cake every day,
Right,
3 meals
all
a
day,
day,
and
you know?
yeah.
But maybe Sunday morning, there's some
Yeah.
chocolate cake, and you're like, you know
That's what
what?
we're wanting
I'm going to have
today.
chocolate cake for breakfast. You go right ahead, right? But it's not, it's a one-off. It's not your everyday kind of stuff,
Yeah.
right?
Yeah.
And the third thing I say is to stop researching. Stop.
This is a
stop
toughie. Oh my God.
looking for that.
Dr. Google has
thing,
saved the world. What do you
right?
mean, Dr. Janice?
There's so much fantastic information out there. There really is. But there's a lot of garbage out there too. And it's hard to sift through all that, right?
Yeah.
And with my fertility patients, they're like, what's that one thing that I'm missing? Maybe
It's
there's
like
that
going down
thing
the
out
rabbit
there
hole,
that's
though.
going to help, or what is it that I need to get that thing that I want? What is going to be that diet that's going to help me lose the weight? What is that one piece that I'm missing, right? And the reality is it's not this one
thing.
simple little thing, right? It's a big complex thing, and it's all of the things working well for you, whatever that means.
and interacting and layering and all the things. And you can't
Yes.
know.
You can't know, right? It's individualized for everyone, but it's a bigger puzzle. It's not just the one piece, right? You're looking at the big picture.
And that kind of goes right almost back into the first and the second piece, which are leading you away from the obsession, which that can be too if you're sitting there researching all day, right? And that's the thing. The minute you get a diagnosis of any type, I mean, we know you're on the internet. We know you're researching. If you've gotten a diagnosis of a family member, we're on the internet researching because we want to know how can we help them? How can we optimize all this stuff?
Yeah.
But you're right. Sometimes it can be too much.
Too much. Information is great, but yeah, it can be too much. And I think becoming informed and being an advocate for your own health and knowing what's going on with your body is a fantastic thing. But getting too deep down that rabbit hole is a tough one,
much.
right?
It's a hard place to live from.
It is. It is. Because again, you get into that obsession, right? And you get stuck there.
Yeah.
So the next piece I say is find your tribe, find your team, find your
like that
support
one.
group,
Yeah.
right? Find the people that are going to help you with whatever it is that you're working towards.
In a supportive way.
In a supportive way. Whether so if that's baby or if that is
Not
you know,
baby.
not baby, if that is something work related, if that is the relationship of your dreams, if that is your health, if that is working with a specific diagnosis, whatever it is, find someone that can help you, right? Find someone that's going to give you an objective point of view, because we get so stuck in it that you just can't see it. You can't see it. And we get so, hyper focused on things and we're trying to do all of the things. It feels really good to just hand it to someone else and say, you take care of me, right? As fit mamas, we're taking, whether you actually have physical children or not, right? We're all mothers. We all care for other people, whether it's your parents, whether it's your neighbor, your siblings, your, friends' kids, your godchildren, your pets, whoever it is, your husband, your wife, whoever, right? We're all mothering someone or something and taking care of someone else. But it's nice to have someone take care of you, right? So find your team, find the people that work for you. I see a lot of people. I do a lot of appointments. I try out a lot of different things. And there's some people that I've seen, lovely practitioners, but just not a thing for me.
Right.
You know, so if chiropractic is your thing and you have a fabulous chiropractor,
Go for it.
awesome.
Yeah.
You know, do that work. But if chiropractor, doesn't really work, maybe massage therapy, maybe acupuncture, maybe an osteopath, maybe a physiotherapist, maybe whoever.
It's worth figuring out who you jive with too, right?
Yes.
Yeah, even if chiropractor, that one wasn't great, or this one, and no judgment, but it's like, this wasn't a good fit. I'm going to try out this same chiropractor or a different chiropractor.
Right. This person was maybe more sports related, and I'm more interested in hormones or digestive health or whatever it is, right?
Yeah.
And then the same thing with fertility. Find someone that can help you, get where you need to be, right? So help you work on all.
And
these
this leads me to the place where it's also really good to notice when something's not a fit, right?
Yes.
Like sometimes we're like, oh, I'll try more, I'll add more people to my team. But sometimes there's one thing that keeps sort of being there as what you want to be working, but isn't. Have you run into that before?
Yes.
You're like not ready to let go yet of some stuff, or
Yeah. I've been there myself before too. Practitioners, lovely people, but at the end of it, it was like, why am I seeing them? I don't really think I'm benefiting from this, or we're not seeing eye to eye, right? We're not speaking the same language, So,
but either way, I like the idea of having a team around you, and it's the way you describe it is so different from going to a practitioner and saying, you fix me, right, and giving our power away. You're saying, I'm taking my power back by finding a team of people who know what my end goal is, don't see me as a number, right? And I remember the times when I used to go see practitioners often with regards to my back, and how frustrating it is from a patient perspective to go in and see a new practitioner, have to describe your injury, problem, issue over and over. I think I cried every single time I saw a new person because it would bring up all the emotions. Having to do that over and over is completely exhausting. It is not something that, any of us are recommending to anybody to go do. But definitely to stay open and find those people who will support you, because you will come across them.
Yeah, absolutely. I really like the point that you made. With you're not expecting them to fix you. You're going there for some specific information, for some specific advice, so that you can heal yourself, right? That person's just going to help you along your journey. They're going to hold your hand.
Yeah, they've been there, or they've seen tons of patients, or they've helped. And that's another thing. I mean, I know for me, it's realizing who you're looking up to in a way, right? Like looking up to someone who has what you have, or let's say has healed, or has, the something that you're desiring. That's a good person, because probably they've been through a lot of the roadblocks. And I know myself, and I know a lot of fit mamas out there are similar in the way that it's like, I got this. I can figure it out myself. I'll just do this one more thing. I'll just research one more, and it's like, when we're ready to finally almost give up, like what you said, try, right?
Yeah.
And surrender to say, hey, you've seen 1,000 patients that have gone through this. What do you got for me?
Yeah,
right?
it's hard to ask for help, right?
So hard, even harder to then receive it, right? We ask, and then we're like, well, if it comes in the little pretty package I want it in, I'll receive.
Yes.
But if it's not what I want, how I think it should look, I'm holding up, my hand to it. And I think that's a big lesson too, right?
If you're going to tell me something I don't want to hear,
then you're not my purpose.
You're not my person.
Anymore, right? But it's hard to stay open-minded and go, okay, is she my person, or is she triggering me? And is she not my person, or is the trigger actually makes her my person, right? You never know. That's
Absolutely.
a tough one.
Absolutely. Been there, done that, and I've certainly seen practitioners that have, called me out on something or made a suggestion, and I've almost, you get triggered, you take offense to it, and you think, oh, what are they even talking about? They don't know me, right? And then it'll be weeks later or months later or maybe hours later that I go, darn it, they got
the
me.
thing I didn't want to hear or see.
Yes.
Yeah,
that
good
pulls
one.
it all together, right? Which is great. It means then we're shifting and we're evolving and we're seeing new things.
There's
you don't
growth
know what you
there.
don't know.
Yeah.
So
that's a
good.
great one. So what's number 5?
The last thing is gratitude. Some kind of gratitude practice, right? And so what I have my patients do is it's just simple. Write down 3 things every day that you're grateful for, right?
Feels so
and
good.
and how full your life is right now. Know there's that other thing that you're wanting, whether it's a baby or your dream relationship or your dream job or your dream home or whatever it is, but what are you happy about now, right? Because as you always say, that gratitude brings more abundance towards us, right?
Yes.
So that just shifts things a lot.
So true. And then it makes the journey that much better too.
Yes. Yeah. And changes perspective. Instead of living this place of lack and I don't have and everyone else does, then it can be like, things are pretty good for me too.
Yeah,
right?
I know. It's so easy to be stuck in, I'm not pregnant, everybody else is. And saying blanket statements like that, everybody else is.
Because it seems like everyone else is, right? You go to Costco, everyone's pregnant in Costco, honestly, right?
Yeah, right. Exactly.
But it's just what you're seeing. You're seeing those things that you
that
want.
perspective shift with gratitude. I love that. I was actually just talking to a girlfriend of mine who was saying they were doing gratitude before dinner. It was, they each, her and her sons and her husband were doing 3 things they were grateful for, before they ate their meal.
Yeah.
And what a beautiful practice,
Love
right?
that.
Because when you integrate it into your daily routine like that, whether it's in your journal at night, whether it's with your prayers with your kids, as we always do, or something that is bringing that into your day today, then like you said, you're not in that lack place where everything I want is not coming, nothing I have is good enough because it's not this one thing I want. Yeah, it's so easy to get stuck in that. Nothing's working, nothing's
working.
What a good switch. Oh, those are such good tips and tools. Janice, honestly, it's been so great having you. I know, because I know you well, we could talk for days and hours.
Days, yes.
So anything you want to leave off in this interview that that we haven't touched on or that you're really passionate about sharing with the Fit Mamas or anything else you want to go with?
No, I think probably just the hormone piece, like we mentioned, because that's one thing that I see so many women struggling with. Or, one thing I was having a chat with someone about the other day is we almost blame everything on our hormones, right? It can be any symptom under the sun, like my foot hurts, and it's like, well, maybe it's my hormones are out of balance, right? I hear that from so many women. Yeah. They're coming in with other symptoms, and they say, I think it's my hormones. I need to really fix my hormones.
Especially with weight loss, you must see that.
Yes, definitely. I think I need to fix my hormones. And it's like, no, this doesn't have anything to do with hormones. Okay. This is actually more to do with your stress hormones, right?
So not hormones, sexual hormones, let's say.
Yes.
Yeah, that's a good point, is differentiating between those, right?
Yeah.
We have the stress hormones that, I'm overwhelmed, I have too much going on in my life. Then here, boom, there's this cascade of release of chemicals going on. And then we have the whole other one, which is the sex hormone related. So those are different pathways.
Yeah. And I think the one thing I hear a lot, it must be my thyroid. My thyroid must be off. I need to get that checked.
Which, can be a case for many people.
For sure.
Yeah.
But there's kind of, there's a bit of a triangle that's happening in the body, right? There's a lot of communication that happens between stress hormones, thyroid hormones, and then our reproductive hormones, right? So when one of them is off, the other ones are going to get thrown off too. So when we might have symptoms of, hormonal imbalance as far as periods go, right? But maybe it's stress hormones that's actually at the root of that, So that's where you really want to dive a little bit deeper and have someone that can look into this with you, right? And
do you go into things like what's contributing to these stresses? Like you go through, what's happening in life,
what's happening in life.
So valuable, and it's often what we don't look at, right?
Yeah, and it's the things that are just acceptable stressors, and it's just part of life, like we talked about before. It's the everyday stuff. It's just busy life, right? And all of the things you've got to do, and they're running around with the kids, and the kids that don't want to eat their breakfast, or there was a joke the other day I read, and it was like, their 3-year-old was crying because the spaghetti was too long, right? Right?
They'll always find something to cry about.
There's something that they're upset about, and it's just like, something. And so we do a lot of stress support. I think that's one thing that, we all think, okay, well, I just have to toughen it up or tough it out, or, this is just normal. But we can modulate the way that your body responds to stress, right? So that's huge.
That is huge.
And sometimes when we fix that, then all of the period stuff, falls into place. The sleep improves, the skin issues, the mood, the weight, the whatever, because we've got that other piece sorted out, right?
Yeah, that's a good point.
Yeah, so it's not just, looking at one simple little thing. It's looking at the
big
whole.
Picture.
It's the big picture. And what else is playing a role? Our diet certainly plays, the foods that we choose certainly plays a role into what our hormones are doing.
Right.
Our sleep patterns or lack of sleep pattern,
And also how tightly linked things like that are to our immunity, right? So no wonder if we're getting sick all the time, or if we're just like I hear from a lot of fit mamas who are basically go from one illness to the next.
Yeah.
Or it's like, oh, I got a cold from my kid again because they caught it at school or whatever the case is. And if we're running into that a lot, what can that be a sign of? Like, would you say that could be hormonal related?
And I definitely hear this a lot from patients, especially with young kids at home. And it's like their immune system goes through a whole new training process, right? Because the kids are bringing something home and then the kids are passing it along to one another, and it just goes through the whole family in cycles for months, right? And this can be a nutritional thing, right? So certainly if there's any nutritional deficiencies, that's going to impact our immune system. Stress is for sure a huge one. Lack of sleep, a huge one, right? So all of those things need to be in place.
Which, as moms, we have not always control over those. Like you said, the kid won't eat the breakfast. We did our damnedest to cook an amazing one, right?
Or I'm trying to get a night's sleep, but
can't get sleep.
This one's throwing up all night, and I was up 6 times changing sheets or whatever,
Which is more
right?
common than we'd like to even talk about.
And then we get run down, and then boom.
So it's having things in place then to support us in those moments, because we really can't control that.
And it's knowing what you need additionally, right? Like I always say to patients, we all have our weak link, and for some of us, that's the immune system. Some of us, that's the digestive system. Some of it's hormones. Some people get headaches. Some people have thyroid issues. Some people have knee pain, right? Whatever your thing is, maybe that's where some additional work needs to go in, right? So if it's your immune system, let's say, maybe what you need to do is really build up your immune system, right? And there's some really amazing, supportive supplements out there, herbal medicines that can do a lovely job of balancing and supporting the immune system.
Even little things, right? Like teas. I'm big into teas. I love traditional medicinal teas.
I was just going to mention them.
Oh my God, I love them. And for me, it's fun as a okay, I'm going to have my tea. And even if it's a little bit of herb boosting, I feel like there's a lot of power there.
Absolutely. And especially, speaking of immune boosting, there's an echinacea tea, there's an elderberry tea. And the lovely thing about elderberry and echinacea is that they're antiviral as well, right? So there's not a lot that we can do for viruses. You've got this cold or whatever it is, and you go to the clinic and you walk away with nothing because it's like, well, there's nothing you can do. It's a virus. You're just going to have to tough it out, right? But those things can really help. So even just a simple tea every day.
And it's so soothing. And I think that's where it comes down to, again, stresses in my life haven't stopped because I decided to brew a tea. And likely this tea is only going to get half drunk and then be freezing. My husband always knows how busy I was because how many teas are left half cold around the house.
Yes, for sure. And the thing that always happens for me with tea is as soon as I make the tea and I think I'm going to have this cup of tea and I'm going to sit down and just have a few moments to relax, that's when the baby wakes up. Like every single time. It's like pour my tea and she's up from her nap. I'm like, okay. And then it sits for hours. Yeah.
Of course, it's true. But even just setting that up and sometimes just the brewing of the tea, right? The boiling of the water, that moment where you're not doing something else, right? Even just switching gears, that kind of stuff. Oh, I would love to talk to you about this for, again, more hours, but we'll have to have you back on the Fit Mom podcast, Janice, for sure. This has been a gift. Thank you for all your wisdom. Thank you for sharing. It's so great to have you here.
Thank you, Jen.
Thank you. Namaste, Fit Mamas. Enjoy your day. We'll talk to you soon. Wow. That was chock full of information. I am so grateful that Dr. Janice could take the time out to speak with us. She has so much wisdom around hormones, fertility, getting pregnant, PMS symptoms, and her attitude towards the whole thing is what I love best. How not to try. I really, really love that piece. And when you're going through a fertility journey, I know for me, when I wanted to have babies, it was a now thing. It wasn't some point in the future. So I totally get it. And she is the one to talk to if you are feeling any frustration, struggles, or needing any guidance with your fertility journey. Thank you so much, Janice. Thank you, Fit Mama, for being here. So grateful to have you. Have a great day. Namaste.